I woke up in the morning with an erection. I went to the bathroom to urinate, slipped on the tile, fell on my penis, and broke it. Hello, friends. My name is Alexander Kardonov, and I am a urologist. I have been working for 6 years. Urology is a branch of clinical medicine that deals with the treatment and diagnosis of the urinary system and the reproductive system in men's body. Many people mistakenly believe that a urologist is exclusively a male doctor, but probably 70% of my consultations are with women. Women also have kidneys and a bladder. They can also have kidney stones, kidney tumors, and inflammatory processes in the organs of the urinary system. Many want to simply get examined, get tested for sexually transmitted infections, and resolve infertility issues. Today we have a scheduled surgery for varicocele, which is a male infertility factor. A married couple has been trying to conceive for a long time without success, and the husband has abnormalities in his sperm analysis, so we will be helping him today. This is a microsurgical procedure, ligation of the spermatic cord veins. Ligation means tying off. Focus on me, just on me.
Can you get hurt from masturbation, and how?
People often ask if it's okay to masturbate, or how often is too often. Understandably, this is usually asked by young guys around 14, 15, or 20 years old. If it's frequent and excessive, it can be a pathological deviation. If it's once every 3 days, maybe once a week, that's normal. Masturbate as much as you want. Of course, you can get hurt from masturbation. If it's vigorous or rough, if it's related to BDSM activities, you can certainly injure your penis. There have been cases where a man put a nut on his penis during masturbation, a railroad nut, the kind that fastens railway tracks. When he finished, he couldn't remove it because blood had pooled in his penis, swelling it like an eggplant. Both in color and size, it matched. He had to come to the urology department. We couldn't remove it. We didn't have the proper tools. So, in a urological hospital setting, we had to call rescuers. They used a metal angle grinder and a diamond blade, cutting it off inch by inch, cooling the nut as they went. I have performed penis enlargement surgeries. There are different methods to lengthen the penis, and methods to increase its girth. You can increase penis girth using hyaluronic acid. It's injected into the shaft of the penis, and if the patient wants to enlarge the glands, today's medicine offers that option too. However, this is dangerous. It can lead to tissue necrosis if too much hyaluronic acid is injected. It can cause ischemia of the blood supply to the glands, as well as potential ischemia of the dorsal vein of the penis. Honestly, I don't like performing maximum enlargement surgeries. It's not my specialty. I find it easier to refuse a patient because it's mostly a psychological issue. Men can be dissatisfied with the results after surgery. Penile injury is actually rare. Sometimes people experience what's called a penile fracture. The most interesting thing is that all patients with this diagnosis usually tell the same story. I woke up in the morning with an erection. I went to the bathroom to urinate, slipped on the tile, fell on my penis, and broke it. Most often, this happens at night because people have sex at night. Some wait until morning, but when they realize that their penis looks like an eggplant in size and volume, they come in. This can't wait. It needs to be operated on immediately. Most often, this happens when a woman is lying on the table, and there is an impact either against the table or the partner's buttocks. There was a funny situation in my practice. After a wild party on a Saturday, a young man comes to me and says, "Last night was great with a girl. There was a lot of alcohol and drugs. I don't remember what happened at night, but I remember her inserting something into my penis. So I came to you for a checkup on Saturday morning." It turned out that the girl decided to surprise the unfamiliar man by inserting a cocktail straw into his penis, and we had to remove it. There are also situations where various foreign objects are inserted into the penis. ranging from metal balls to mercury thermometers, because they anatomically fit well. For some reason, men like to do this. It's not always true to think that visiting a urologist is always painful. No, it all depends on the skill of the practitioner. The scariest tool for all men who hate and say, "I know this will hurt," is the urogenital probe, which is inserted into the urethra for testing for sexually transmitted infections. There are situations when men feel shy during the appointment. When you say, "Take off your pants," they ask, "Completely off?" I say, "Yes, completely." They take them off. "And my underwear?" I say, "Yes, take off your underwear too." One of the funny stories I had was when a follower sent me a message. "My penis is 5.5 inches. My father's penis is 630 inches. What will be the size of my child's penis?" More often, people come with a specific problem that they want to solve. These can be serious problems ranging from cancer to inflammatory diseases. Men tend to endure and not admit that they are ill. Therefore, there are situations where they come with advanced stages of prostate cancer. These patients often trust traditional medicine. "I'll eat mushrooms, and everything will be fine." But when metastases appear, they come to the doctor for consultation with advanced, unfortunately, stages. Men who have undergone prostate cancer removal rarely have erections afterward because the nerve endings are cut. So these patients are offered phalloplasty. Prostheses are implanted in the penis so that they can have sex and derive pleasure from it. Kidney stones are a very common pathology among people of all ages, from children to men and women. There are about 500,000 reasons for stone formation. It's impossible to determine the true cause of the problem. A stone can be loose, soft, or very hard. The largest stone I had to remove from a patient. He was bedridden, a young guy, by the way, and he couldn't decide on the surgery for a long time. And then he finally decided. We operated on him, removed a stone about 2 by 2 inches in size. That's approximately, well, a little smaller than an ostrich egg. If it's a small fragment of stone, it can come out on its own. Of course, the ratio needs to be evaluated, where the stone got stuck, what the size of the stone was. Passing a kidney stone causes incredibly intense pain. A person who has experienced renal colic will never mistake it for anything else. It's incredibly intense pain. They are comparable to female physiological childbirth. I have an interesting story. A young guy, 19 years old, came to me complaining that he wasn't ejaculating sperm. That is, he feels orgasm, but there is no semen. The first suspicion was retrograde ejaculation. When ejaculation occurs, sperm is not expelled into the urethra, as it should be physiologically, but is retrogradely thrown into the bladder and should then flow out from there. But unfortunately, that didn't happen with him. We performed a testicular biopsy on him, where, unfortunately, no sperm were found. At this stage, he is currently undergoing further examination, so we stimulate spermatogenesis to repeat the biopsy in 4 months, with possible subsequent cryopreservation of sperm. This is freezing sperm for further fertilization if necessary. Perhaps the most difficult part is conveying information to the patient. People may underestimate the problem. When you tell people you have an oncological problem, it needs to be addressed before there are clinical manifestations, and people refuse to believe it. They say, "I don't have anything, I feel fine, I'm alive, I walk, nothing hurts me." I explain that it needs to be done now. Unfortunately, after a year or two, they come back and say, "Okay, help." And you already say, "You missed your moment." When people find out that I'm a urologist, they are really surprised. "You're a urologist?" Especially if they find out at some party or event, immediately, "Oh, you're a urologist? I have a question, let's talk about it." "Yes, my friend told me he has a problem. What should he do?" The downsides of the job are probably like any other doctors. They often call at night. At 4 in the morning, at 12 o'clock at night, they might ask, "What should I do? I found your phone number on the internet. You're a doctor, right? Tell me what to do." The advantages of the job. Well, I have a great profession. I'm very happy to be a urologist. I really like it. I always enjoy going to work. It's nice to bring joy to patients. They come to you with a problem. They can suffer for several years, go from one doctor's office to another, and no one can help. But you manage to help, for example, to help a couple conceive. When they send you photos, here I am pregnant, and here we have already given birth. The baby weighs 7 pounds. It's cool to see that you participated in that too. Being a urologist, I don't even know, well, I'd probably say cliches. I don't know what else I would do, but I like my job.